Right now, as you sit watching this video, your legs and feet may be sending quiet signals about the condition of your heart, and you might be brushing them off as nothing more than fatigue, aging, or a long day on your feet. In the United States alone, millions of people are living with heart failure. Many of them did not experience dramatic chest pain in the beginning. They did not collapse suddenly. Instead, their bodies whispered to them through subtle changes in their lower legs, ankles, and feet. Swelling that seemed harmless, cold feet that never quite warmed up, a strange heaviness while walking. Most people assume these changes are simply part of getting older. But what if they are not? What if your legs are actually early messengers of a heart that is struggling to keep up? And here is something that may surprise you. One of the most overlooked warning signs often appears at night and affects a large percentage of people with developing heart failure, yet almost no one connects it to the heart. Today, we are going to carefully walk through 12 warning signs that can show up in your legs and feet when the heart begins to weaken. These are not myths. These patterns are recognized in medical research and clinical observation. If you notice more than one of these signs, it does not mean you should panic, but it does mean you should pay attention. Let's begin by understanding why your legs and feet are often the first to show changes. Medical framing. Heart failure does not mean the heart has stopped. It means the heart is no longer pumping blood as efficiently as it should. Your heart's job is simple but vital. Push oxygen, rich blood throughout your body, and return oxygen, poor blood back to the lungs. When this pumping action weakens, blood flow slows down. Pressure builds in the veins. Fluid begins to leak into surrounding tissues. Now here is why your legs are involved. Your legs and feet are the farthest points from your heart. Blood has to travel downward against gravity and then return upward. That return journey requires strong circulation. If the heart weakens, your body prioritizes essential organs, your brain, lungs, and kidneys. Blood flow to the extremities becomes less efficient. Because of gravity, excess fluid also tends to collect in the lowest parts of the body, your ankles, lower legs, and feet. This is why many early signs of heart dysfunction appear there first. Let's now go through each warning sign carefully. Symptom 1. Persistently cold feet that don't warm up. Let's begin with something that many people laugh about. Cold feet. You may have experienced it yourself. You're sitting comfortably in your living room. The temperature in the house feels fine. Your hands feel normal. Your face feels warm. But your feet, for some reason, feel unusually cold. Most people dismiss this immediately. They blame poor circulation. They blame age. They blame tile flooring. They reach for thicker socks. And usually, that explanation is harmless. But when cold feet become persistent when they remain cold regardless of room temperature, physical movement, or warm clothing, your body may be signaling something deeper. To understand why this happens, we need to look at how your heart distributes blood. Your heart is responsible for pushing oxygen-rich blood to every part of your body, but it does not distribute that blood equally when it is under stress. When the heart begins to weaken, it has to make subtle adjustments. It prioritizes vital organs, your brain, your lungs, your kidneys. These systems must stay supplied for survival. Your feet, however, are at the farthest end of your circulatory system. They require strong pressure and steady output from the heart to maintain warmth and proper oxygen levels. If cardiac output decreases, blood flow to the extremities may gradually reduce. This reduction is often mild at first, so mild that you do not notice it during activity. But during rest, when circulation naturally slows, it becomes more noticeable. That lingering cold sensation is not always about temperature. It can reflect reduced warm blood reaching the smallest vessels in your feet. Now here is something important. Normal cold feet warm up when you walk. Movement increases circulation. Muscles contract. Blood flows more vigorously. But when heart function is compromised, walking may not fully resolve the cold sensation. In some cases, the feet remain cool, even under blankets. Another subtle sign is contrast. If your feet feel significantly colder than your hands, even in a neutral environment, this imbalance can reflect circulation changes. Why do people ignore this symptom? Because it is not dramatic. There is no sharp pain, no alarming swelling, no immediate emergency, just cold feet. But persistent cold extremities, especially when paired with fatigue, swelling, or shortness of breath, deserve attention. It does not automatically mean heart failure. There are many causes of cold feet, including thyroid conditions and peripheral artery disease. However, when the heart is unable to maintain strong forward flow, the feet are often among the first areas to show subtle changes. Think of it this way. Your body whispers before it shouts. Cold feet that do not respond to warmth or movement may be one of those whispers. And when multiple whispers begin to appear together, they form a message that should not be ignored. Symptom 2. Swelling in the ankles that doesn't go away. Now let's talk about something many people notice but rarely take seriously. Swollen ankles. You may see it at the end of the day. Your socks leave deeper marks. Your shoes feel tighter than they did in the morning. The skin around your ankles looks slightly puffy. Most people immediately assume it's from standing too long, or maybe eating salty food, or simply getting older. And sometimes, that explanation is completely reasonable. But when ankle swelling becomes frequent, symmetrical in both legs, and gradually more persistent, it may be your circulatory system struggling to keep balance. To understand why, let's look at what happens inside the body when the heart weakens. Your heart does not just push blood forward, it also helps maintain pressure that allows blood to return upward from your legs. When the heart begins to lose pumping strength, particularly on the right side, blood returning from the body can slow down. That slowdown creates increased pressure inside the veins. Think of it like traffic backing up on a highway. When forward movement slows, everything behind it begins to pile up. That increased pressure in the veins forces fluid out of the blood vessels and into the surrounding tissues. And because gravity constantly pulls fluid downward, the ankles become one of the first collection points. At first, the swelling may be mild. You might only notice it after long days. By morning, it improves slightly. But over time, the pattern changes. You may wake up with puffiness that no longer fully resolves. The swelling may extend upward toward the lower legs. The skin may feel tight or stretched. Another subtle detail is symmetry. Heart-related swelling usually affects both legs fairly evenly. If only one ankle is swollen, that may point toward a different issue, such as a localized vein problem or injury. Why do people ignore this symptom? Because it develops slowly. There is no sudden dramatic pain, no immediate loss of function, just gradual puffiness that seems manageable. But persistent ankle swelling is not simply cosmetic. It reflects fluid imbalance. And fluid imbalance often means the heart is not circulating blood efficiently enough to prevent buildup. When swelling becomes consistent, worsens over time, or is accompanied by weight gain or shortness of breath, it should never be dismissed. Your ankles may appear small and insignificant compared to your heart, but in many cases, they are the first visible evidence that circulation is under strain. And once again, your body may be whispering long before it begins to shout. Symptom 3. Pitting edema, when swelling leaves a mark. At first glance, swelling in the legs may seem harmless. But there is a particular type of swelling that tells a more specific story about what may be happening inside your body. It is called pitting edema. This is something doctors routinely check during physical examinations, and you can gently observe it yourself. Here is how it works. If your lower leg or ankle appears swollen, press your thumb firmly into the area for about 10 seconds. Then slowly remove your finger. If the skin immediately returns to normal, that swelling may be mild. But if a visible indentation remains a small dent that lingers for several seconds before slowly rising back, that is called pitting. Why does this happen? When the heart struggles to pump blood effectively, especially on the right side, blood returning from the body can begin to accumulate in the veins. This buildup increases pressure inside those vessels. As the pressure rises, fluid is pushed out of the blood vessels and into the surrounding tissues. Over time, the tissues become saturated with this excess fluid. When you press into fluid-filled tissue, the liquid shifts temporarily, creating that indentation. And because the area is overloaded, it takes time for the fluid to redistribute and the skin to rebound. Pitting edema is not simply surface swelling. It is a sign that your circulatory system is retaining more fluid than it should. Many people ignore it because it does not hurt. There is no sharp pain, no burning sensation, just softness beneath the skin. But this softness reflects congestion within the vascular system. As heart function weakens, the body attempts to compensate. Hormonal systems activate to retain salt and water in an effort to maintain blood pressure. Unfortunately, this compensation can worsen fluid retention. The result? More swelling, more pressure, more strain on the heart. Pitting edema often appears gradually. At first, the dent may be shallow. Later, it becomes deeper and slower to recover. It is also commonly symmetrical, affecting both legs similarly. While pitting edema can occur for other reasons, including kidney or liver conditions when paired with fatigue, weight gain, or breathlessness, it becomes more concerning. The key point is this: swelling that leaves a visible imprint is not random. It reflects fluid that has moved beyond where it should normally remain. And when fluid begins to accumulate in your lower body, it may be an early signal that your heart is no longer managing circulation as efficiently as it once did. Again, it may begin quietly, but quiet signs often precede louder consequences. Symptom 4. Sudden, unexplained weight gain from fluid retention. Now let's talk about something that can be both confusing and alarming. You step on the scale one morning and notice you have gained 3, 4, even 5 pounds in just a few days. You haven't changed your diet. You haven't overeaten. You haven't reduced your activity level. Yet the number is higher. Most people immediately assume it must be body fat. But true fat gain does not happen overnight. When weight increases rapidly over a short period of time, especially when accompanied by swelling in the legs and ankles, it is often fluid, not fat. Here is why this matters. When the heart begins to struggle, it cannot circulate blood as efficiently. This reduced efficiency triggers several compensatory mechanisms inside the body. One of those mechanisms involves the kidneys. When circulation weakens, the kidneys may interpret it as low blood volume. In response, they retain sodium and water in an effort to stabilize blood pressure. While this response is meant to help, it can actually worsen fluid overload when heart function is impaired. The retained fluid does not remain evenly distributed throughout the body. Gravity pulls it downward. As a result, the lower legs, ankles, and feet may swell, and overall body weight increases quickly. You may notice your pants feel tighter around the calves. Your shoes may suddenly feel snug. Rings may also feel slightly tighter if fluid retention becomes more widespread. Unlike gradual weight gain from dietary habits, fluid-related weight gain often feels different. It may come with a sense of heaviness. Your legs may feel tight or full. The skin may appear stretched. Why do people dismiss this symptom? Because weight naturally fluctuates. A pound or two can change based on hydration or meals. But a gain of several pounds within a few days, especially if it continues rising, deserves attention. Medical professionals often advise patients with known heart conditions to monitor their weight daily. A sudden increase can be one of the earliest indicators that fluid is accumulating and the heart is under strain. The scale, in this case, becomes an early warning tool. The important thing to understand is that this type of weight gain is not cosmetic. It is a reflection of internal fluid imbalance. When the heart cannot effectively manage circulation, fluid begins to collect where it should not. If rapid weight gain appears alongside ankle swelling, fatigue, or shortness of breath, it should not be ignored. Because once again, your body may be signaling that the balance of circulation has begun to shift long before a medical emergency occurs. Symptom 5. Legs that feel unusually heavy or weak. Let's move to something that many people quietly accept as just getting older, a feeling of heaviness in the legs. You walk up a short flight of stairs and your legs feel unusually tired. You stand from a seated position and they feel unstable. A short walk that once felt easy now feels demanding. At first, you may blame inactivity, or age, or lack of exercise. And while those factors can certainly contribute to muscle weakness, there is another possibility that deserves consideration. When the heart begins to weaken, its ability to deliver oxygen-rich blood to working muscles decreases. Your leg muscles are among the largest muscle groups in your body. They require consistent, strong circulation to function properly, especially during movement. When cardiac output declines, muscles may not receive enough oxygen during activity. This leads to early fatigue. Instead of feeling energized after walking, your legs may feel heavy, almost as if they are carrying extra weight. Internally, what is happening? Muscles rely on oxygen to produce energy. When oxygen delivery becomes limited, muscle cells cannot generate energy efficiently. Waste products accumulate more quickly, contributing to that tired, aching sensation. Over time, reduced circulation can even affect muscle structure. Physical endurance may decline gradually. Many individuals notice that they are avoiding stairs more often. They may sit down more frequently. They may reduce activity without consciously deciding to. The body adapts to what feels easier. Why is this symptom often ignored? Because it develops slowly. There is no dramatic collapse, no sharp, alarming pain, just gradual reduction in stamina. But here is an important distinction. Normal aging may reduce strength gradually over years. Circulatory-related weakness often feels like a noticeable shift, something that changes within weeks or months rather than years. You may find yourself thinking, "This didn't used to feel this hard." If leg heaviness appears alongside swelling, rapid weight gain, or cold feet, the combination becomes more meaningful. It suggests that circulation may not be meeting your body's demands. Reduced blood flow does not only affect comfort, it affects mobility. And mobility affects independence. The earlier reduced circulation is identified, the more effectively it can be managed. Because once again, your legs may be reflecting the workload your heart is struggling to carry. And heaviness in the legs is sometimes more than simple fatigue. It can be a quiet signal that oxygen delivery is no longer as efficient as it once was. Symptom 6. Cramping or pain in the legs while walking. Now let's focus on a symptom that directly affects your ability to move freely. You begin walking maybe to the mailbox, around the grocery store, or through your neighborhood, and after a short distance, your calves start to ache. It may feel like tightness, or cramping, or a deep muscle soreness that forces you to stop and rest. When you pause for a few minutes, the discomfort eases. Then when you start walking again, it returns. Many people assume this is simple muscle strain or aging joints, but recurring leg pain that appears during activity and improves with rest can be a sign that your muscles are not receiving enough oxygen-rich blood when they need it most. Let's understand why. When you walk, your leg muscles demand more oxygen to produce energy. In response, a healthy heart increases blood flow to meet that demand. But if the heart is struggling to pump efficiently, it may not be able to increase output adequately. As a result, your muscles temporarily operate with limited oxygen. This leads to a buildup of metabolic byproducts inside the muscle tissue, which triggers that aching, cramping sensation. Over time, this reduced circulation can significantly limit physical endurance. At first, you may only notice discomfort during longer walks. Later, even short distances become challenging. You may unconsciously begin planning your day around avoiding unnecessary walking. Why is this symptom often ignored? Because it can be blamed on many things: arthritis, deconditioning, poor footwear, minor injuries. And while those are valid possibilities, consistent activity-related pain should not be dismissed, especially if it is new or worsening. When circulation is compromised, the body sends signals through discomfort. This is not simply about sore muscles. It is about oxygen delivery. If blood cannot reach your working muscles effectively, your ability to move freely begins to decline. And movement is critical for maintaining heart health in the first place. Reduced activity leads to further weakening, creating a cycle that becomes harder to reverse. If leg pain during walking appears alongside swelling, fatigue, or cold extremities, it strengthens the case that circulation may be involved. It does not mean immediate crisis, but it does mean evaluation is wise. Because once again, your legs may be communicating something subtle, that the engine powering your circulation is not performing as strongly as it once did. And early attention can prevent that subtle limitation from becoming a major restriction on your independence. Symptom 7. Slow healing cuts or sores on your legs and feet. Now let's talk about something that may seem minor at first: a small cut, scrape, or sore on your foot that simply refuses to heal. Maybe you bumped into furniture. Maybe a shoe rubbed against your heel. Maybe you didn't even notice how the wound started. Under normal circumstances, the body begins repairing damaged skin almost immediately. Blood delivers oxygen. White blood cells fight bacteria. New tissue forms. The wound gradually closes. But when circulation is compromised, that entire healing process slows down. If your heart is not pumping efficiently, oxygen-rich blood may not reach the smallest blood vessels in your feet and lower legs with enough force or consistency. And without oxygen, tissues struggle to repair themselves. What might normally heal in a week can linger for several weeks or longer. You may notice a scab that keeps reopening, redness that doesn't fade, a sore that looks shallow but never fully closes. Why does this happen? Because wound healing is energy-intensive. Cells require nutrients and oxygen to rebuild tissue. Reduced blood flow limits that supply. In addition, chronic swelling in the legs can stretch the skin, making it thinner and more fragile. This increases the likelihood of small tears and makes healing even more difficult. Over time, persistent swelling can also reduce the skin's natural defenses, allowing bacteria to enter more easily. Many people ignore slow-healing wounds because they seem minor. There is no intense pain, no dramatic bleeding, just a stubborn spot that won't improve. But persistent wounds in the lower legs and feet should never be dismissed, especially in older adults. They can signal circulation problems, and circulation problems often trace back to either vascular disease or cardiac inefficiency. Another subtle sign is color change around the wound. Skin may appear darker, shinier, or slightly discolored due to fluid buildup and pressure within the veins. If you notice that small injuries are taking significantly longer to heal than they used to, especially alongside swelling, heaviness, or cold feet, this combination becomes more meaningful. Your body repairs itself through blood flow. If repair slows, it may be because circulation is not as strong as it once was. Addressing the underlying cause early can prevent minor wounds from becoming serious complications. Because once again, what appears small on the surface may reflect something larger beneath it, and your legs may be revealing that your circulatory system is under quiet strain. Symptom 8. Shiny, tight, or discolored skin on the lower legs. Now let's look at a change that is easy to see but easy to overlook. Take a moment to look at the skin on your lower legs. Does it appear tighter than it used to? Shinier, almost as if it has been gently stretched? Healthy skin has a natural texture. It reflects light softly. It has small lines, pores, and subtle variation. But when fluid begins to accumulate beneath the skin, its appearance can change. As circulation slows and pressure builds in the veins, fluid leaks into surrounding tissues. Over time, this excess fluid stretches the skin outward. Just like inflating a balloon, the more pressure beneath the surface, the smoother and shinier the exterior becomes. You may notice that the skin looks glossy, especially around the ankles. It may feel firm or tight when touched. Sometimes it may appear thinner, as if the underlying structures are closer to the surface. Why does this happen? When the heart is not pumping efficiently, blood returning from the lower body slows down. Increased venous pressure pushes fluid into surrounding tissues. This persistent swelling alters the structure of the skin. Chronic pressure can also lead to subtle color changes. The skin may develop a darker or slightly reddish-brown tone in some areas. This can occur because tiny blood vessels become stressed, and small amounts of blood components leak into surrounding tissue over time. These discolorations are not cosmetic issues. They are signs of prolonged circulatory strain. Many people dismiss shiny or tight skin as simple dryness or aging. They may apply lotion. They may assume it's weather-related. They may think nothing of it. But when skin changes occur alongside swelling, weight gain, or heaviness in the legs, it paints a larger picture. Another important detail is skin fragility. Stretched skin can become more delicate and prone to injury. Even minor bumps may leave marks more easily. If you gently press your finger into the area and the indentation lingers, that may also indicate fluid retention beneath the surface. Your skin is not just a protective covering. It is a reflection of what is happening beneath it. When circulation is strong, tissues remain well-nourished and balanced. When circulation weakens, changes begin to appear, sometimes subtly, sometimes visibly. Shiny, tight, or discolored skin on the lower legs may not cause pain, but it may be one of the body's visual signals that fluid balance and venous pressure are no longer stable. And once again, the earlier such changes are noticed, the greater the opportunity to address the underlying cause before more serious complications develop. Symptom 9. Nighttime restlessness, or an unexplainable urge to move your legs. Now we arrive at the symptom that many people experience, but almost never connect to the heart. It happens at night. You lie down after a long day, hoping to rest. Your body feels tired. Your mind wants sleep, but your legs begin to feel unsettled. A strange crawling sensation, a tingling beneath the skin, an uncomfortable urge to move. You shift positions. You rub your calves. You stretch. For a moment, it improves. Then it returns. Many people assume this is simple, restless leg syndrome, and sometimes it is. But in certain cases, especially when accompanied by swelling or fluid retention during the day-nighttime leg discomfort, can reflect changes in fluid distribution. Here's what may be happening. During the day, gravity pulls fluid downward into your lower legs and ankles. If your heart is not circulating efficiently, this fluid accumulation becomes more pronounced. You may not consciously notice how much fluid has settled in your lower extremities. But when you lie down at night, gravity's pull changes. The fluid that gathered in your legs begins to shift back toward your core circulation. This redistribution increases pressure in certain blood vessels and tissues. It can also affect the tiny nerves in your legs. The result? Uncomfortable sensations, tingling, crawling, cramping, or an almost irresistible need to move. For some people, this discomfort disrupts sleep night after night. They may wake up repeatedly. They may struggle to fall asleep at all. They may feel chronically fatigued during the day. Why is this symptom often ignored? Because it feels neurological. It feels like a nerve issue, or a vitamin deficiency, or simple restlessness. Rarely does someone think this might be circulation-related. But fluid shifting during rest is a known phenomenon in individuals with reduced cardiac efficiency. The body's position changes, and circulation patterns adjust accordingly. If nighttime leg discomfort appears alongside swelling, rapid weight gain, or heaviness in the legs, the combination becomes more significant. Sleep disruption also places additional strain on the heart over time. Poor rest affects blood pressure regulation and overall cardiovascular health. Again, this does not mean every case of restless legs points to heart failure. But when leg sensations worsen at night and are paired with other signs of fluid retention, it is wise not to dismiss the pattern, because sometimes what feels like simple nighttime discomfort may actually be your circulatory system responding to gravity, fluid movement, and a heart that is working harder than it should. And recognizing that connection early can make a meaningful difference. Symptom 10. Numbness, tingling, or pins and needles in the feet. Let's talk about a sensation many people have felt at some point, but rarely question deeply. Your foot feels like it has fallen asleep. There is tingling, a prickling sensation, maybe even a slight burning feeling. Normally, this happens when you sit in one position too long and compress a nerve. Once you move, sensation returns quickly. But what if that numbness appears more frequently? What if it lingers longer than it used to? Or worse, what if it begins happening even when you are not sitting awkwardly? When the heart's pumping efficiency declines, reduced blood flow to the lower extremities can affect not only muscles and skin, but also nerves. Peripheral nerves depend heavily on steady oxygen delivery. If circulation slows, those nerves may not receive adequate oxygen and nutrients to function properly. When nerve cells are deprived of sufficient oxygen, they begin to misfire. Instead of sending clear signals, they produce abnormal sensations, tingling, buzzing, pins and needles, or partial numbness. In addition to reduced oxygen supply, fluid buildup in the legs can physically compress tiny nerve endings. Swollen tissue creates pressure in confined spaces. That pressure interferes with normal nerve signaling. Many people automatically assume numbness in the feet must be related to diabetes, And while diabetes is a common cause of neuropathy, it is not the only one. Circulatory compromise can produce similar sensations. Why is this symptom easy to ignore? Because it comes and goes at first. It may last only a few minutes. It may feel mild. It may not interfere significantly with walking, at least initially. But as circulation weakens further, the sensation can become more persistent. Some individuals describe feeling as though they are walking on cotton. Others say their feet feel slightly disconnected from the ground. This can subtly affect balance, and balance affects safety. Reduced sensation in the feet increases the risk of falls, particularly in older adults. If tingling or numbness appears alongside swelling, cold feet, or leg heaviness, it strengthens the possibility that circulation is playing a role. The key point is this: your nerves require healthy blood flow to function properly. When circulation weakens, nerve signals may become distorted. What begins as a mild tingling sensation may be one of the early indicators that oxygen delivery to your extremities is no longer optimal. Again, this does not mean panic, but it does mean awareness. Because even subtle sensory changes in your feet may reflect broader changes within your circulatory system. And the earlier those changes are evaluated, the more options exist to manage them effectively. Symptom 11. Varicose veins that worsen or appear suddenly. Now let's focus on something visible, something you can see with your own eyes. Varicose veins. These enlarged, twisted veins often appear on the lower legs and are commonly associated with aging or standing for long periods. Many people live with mild varicose veins for years without concern. But when they suddenly become more prominent, darker, more swollen, or more uncomfortable, it may reflect deeper changes in circulation. To understand why, let's look at how veins work. Veins carry blood back to the heart. Unlike arteries, they rely on small one-way valves to prevent blood from flowing backward. Each time your leg muscles contract while walking, they help push blood upward against gravity. But when the heart weakens and circulation slows, pressure inside the venous system increases. Think of it like a plumbing system. If water cannot move forward efficiently, pressure builds behind it. That increased pressure stretches the walls of veins, especially those already weakened by age or genetics. The valves inside the veins may begin to fail under that stress. As a result, blood pools in the lower legs instead of returning smoothly to the heart. This pooling causes veins to enlarge and become more visible. If you notice that veins which were once subtle have become significantly more raised, tender, or widespread over a short period of time, it may not be random. It may be a sign that venous pressure has increased. Why is this symptom often dismissed? Because varicose veins are common. They are often viewed as cosmetic rather than medical. But rapid progression is different from slow development over many years. If swelling accompanies worsening veins, or if the skin around them becomes shiny or discolored, it strengthens the concern that fluid and pressure are building in the lower extremities. In some cases, increased venous pressure can also lead to a feeling of aching or fullness in the legs by the end of the day. The important distinction here is change. Stable veins over many years are one thing. Veins that suddenly enlarge, darken, or multiply over months may reflect altered circulation dynamics. Your veins are part of your heart's extended system. When the heart struggles to maintain forward flow, backward pressure often appears in the veins first. And visible changes in those veins may be one of the outward signs that internal pressure is rising. Again, it is not about alarm. It is about awareness. Because sometimes, what appears on the surface of your legs may be reflecting strain deeper within your circulatory system. Symptom 12. Bluish or darkened color in the feet and lower legs. Now we come to a sign that is often subtle at first, but visually important. Take a careful look at your feet and lower legs. Do they ever appear slightly darker than usual? Do your toes sometimes look faintly bluish or purplish, especially when sitting for long periods? Does the color improve when you elevate your legs but return later? This change in skin tone may reflect a condition related to reduced oxygen delivery. Healthy blood, rich in oxygen, gives skin a natural pink or warm tone. But when blood flow slows, or oxygen levels in the circulating blood decrease, the skin can take on a bluish or dusky appearance. This is sometimes referred to as peripheral cyanosis. Why does this happen in circulation problems? When the heart is not pumping effectively, blood may move more slowly through the smallest vessels in the feet and lower legs. As oxygen is delivered to tissues, the remaining blood becomes darker before returning to the heart. If circulation is sluggish, that darker, oxygen-depleted blood can linger longer in the extremities. Because gravity pulls blood downward, the lower legs are often the first place where this effect becomes visible. You may notice the discoloration more clearly after sitting or standing for extended periods. In early stages, the change may be mild, barely noticeable unless you compare both feet carefully. Over time, it may become more pronounced. Some individuals also notice their toes appearing slightly purplish in cooler environments. Why is this symptom frequently ignored? Because lighting conditions vary. Skin tone naturally differs among individuals, and mild color changes can be attributed to temperature. But persistent or progressive discoloration, especially when combined with swelling, numbness, or cold feet, deserves attention. Color change is not merely cosmetic. It reflects oxygen delivery and blood movement. When tissues are not receiving adequate oxygen, cellular function begins to suffer. This can increase vulnerability to skin breakdown and slow healing. Another key detail is recovery time. If you elevate your legs and the color improves quickly, circulation may still be adjusting normally. But if discoloration remains even after rest, it may suggest more significant circulatory strain. Your skin provides visible clues about internal blood flow. A bluish or darkened appearance in the lower extremities can be one of the clearer outward indicators that oxygen-rich blood is not reaching those tissues as effectively as it once did. And while this sign may develop quietly, it should never be dismissed. Because once again, your legs may be reflecting the strength or weakness of the heart that supplies them. Emotional wrap-up. Your legs and feet are not random parts of your body. They are early warning systems. The heart rarely fails without sending signals first. Most people expect dramatic chest pain, but more often the heart communicates quietly through swelling, through fatigue, through subtle changes in skin or sensation. Early recognition can dramatically improve outcomes. Modern treatments are far more effective when heart dysfunction is identified early. Ignoring symptoms does not make them disappear. Listening to your body may protect your independence and quality of life for years to come. Soft CTA? Calm? If you found this information helpful, type 1 in the comments. If you are already aware of these signs, type 0. Your engagement helps others see this message. And if you want more clear, practical health discussions like this, consider subscribing and turning on notifications. Most importantly, do not ignore persistent changes in your legs or feet. They may be telling you something important. Thank you for taking the time to protect your health.